Hi, my name is Kathleen. I am the RN Supervisor for the Infusion Clinic here at North Houston. I originally come from main campus as an infusion nurse in 2019 to 2020, and I left and moved to Mobile, Alabama, and I had an opportunity to come back here to North Houston to become a supervisor and actually jumped at the chance. So I love Kelsey-Seybold. Oncology nursing, when I was in school as a practical nurse 100 years ago, I did not want to be an oncology nurse, but for some reason I spoke it out loud and said that I never wanted to work with oncology patients, and here I am. In fact, I never knew that I would be an infusion nurse ever, and here I am, and it is the best specialty. Oncology is a breed of their own. Oncology patients are people that are faced with things that we don't even imagine on a daily basis. They look at life like no other. So they are the happiest people that I know in the most devastating of circumstances. Not only the patients, but the staff. The crew here at North Houston, the infusion nurses in both the infusion area, the hematology oncology clinic area, the front desk staff, leadership, social work, everyone, lab people, everybody inspires me to come because everybody meets everybody with a smile and a good morning and a how are you. And it's just, when you do what you love, you never work a day in your life. There's so many. When you look into the eyes of a patient, and this, I can't think of just one specific patient, but this is for many patients. When you look into the eyes of a patient and they're so relieved when they know that you are here and you're going to keep them safe. When you walk in and you see your patient who is going through chemo and probably facing some pretty hard stuff, they're relaxed in your chair, they're sitting back, they're comfortable, and they're not afraid anymore. And the other end is when you look into their eyes and they tell you that they're tired. And you just want to hug them and do everything that you can to make every minute of their life the best and peaceful. Anybody that's looking to come into oncology nursing, what I would ask and what I would tell you is that this is an area that needs a lot of empathy, a lot of happiness, and a lot of attention to detail, not only to what you're giving, but to who you're giving it to. These people need you. They all need us. All the patients need us in every nursing specialty that is out there. But oncology patients are special and different in our own atmosphere. We're all made to have one specialty, some pediatrics, some ICU. Oncology is a calling. It's not just a place to go. So I would say come to Kelsey-Seybold. I've been a nurse for a long time. I've been around the medical center down in Houston for 20 years or so, and Kelsey-Seybold has made me feel the safest as a nurse, and leadership, and they are above and beyond. They listen. The one thing that you want as a nurse is to be heard and help to move change. And you can do that here in Kelsey-Seybold. If you see something, you say something, and usually it gets done.